Hi, this is Brian Schwebke, physical therapist with Paramount Performance. Today I want to talk a little bit about motor control and the four components that make it up. So the four parts of it are mobility, stability, controlled mobility, and skill. We'll real quick just kind of break it down and then I'll talk a little bit about where we run into problems in the performance training world. So with mobility, we're talking about the joints and the way those joints move, whether that's an elbow, the hips, the low back, whatever. Stability is now taking that mobility and adding some active muscle strength to it. So being able to hold in one place without moving around. So we're learning to stabilize at that joint. Controlled mobility is now taking that to the next step where we're actively moving through the joint while stabilizing for a more controlled and precise movement. And then skill would be taking it to the end of the spectrum where we're doing things like running, jumping, squatting, more dynamic type movements. Now the problem with most performance training programs is that most strength coaches and even some physical therapists will take it to too high of a level too quickly. So you see people coming in and spending much more time in the skills area with maybe just a little bit of time in the controlled mobility, but very little time in mobility or stability. This is very important because the mobility and stability part is what's building the base for everything else that happens on top of it. It's like having a pyramid. So this is where it can be very beneficial for an athlete to get in and see a physical therapist early on in their training before there's an injury so that they're able to address these mobility and stability problems to help them be a little bit safer and perform at a higher level as they move forward. As it is, most of the time when an athlete comes in to see me as a patient, we are already taking a step back to those first two levels to have to treat those before we can move forward. So whether I address it pre-injury or post-injury doesn't really matter. All that matters is that if it's post-injury, now we're starting to lose playing time and practice time. If you have any more questions about motor control or the components that make it up, or what your program maybe needs to help you be a little bit safer or perform at a higher level, please check out our website at paramountperformancept.com.